Just before we are about to start the reflexology, I like to warm up the foot and feet area before we begin. So again, just doing some nice squeezes of the foot, squeeze, drawing the fingers outwards, some nice rolls around the ankles, and then a couple of swooshy motions up the leg and around the ankle. And some squeeze of the toes. And then once you feel you are ready, we can then begin the reflexology. Hi, welcome to reflexology training. So today we're going to go through the methods and techniques to use for reflexology, going through the basics and the anatomy as well during this process. Reflexology is different to foot massage. Foot massage is more focused on muscle and tendons, whereas reflexology is linked to internal organs. And again, we will go through these step by step as we go along. One thing to consider before with your client, if your client does have any open wounds or signs of infection or extremely swollen feet or ankles, I'd recommend not doing reflexology. And again, ask that client to rebook in once that has been sorted. Reflexology is really helpful to release stress, tension in the body, and allow for relaxation. At no point should anyone feel pain during reflexology. This should be a very relaxing experience. Before we get started, I will just talk through the basics of reflexology, linking into the 5 metatarsal areas. So with reflexology, we'll be working down the 5 lines of the metatarsals on the plantar side of the foot. And then also we'll be working then across the 5 areas which we'll be using techniques for. We'll then work onto the top of the foot, the dorsal area of the foot, and then work around the edges to finish down the vertebrae line. Linking with the toes, so toes are connected with the head and neck area. So again, for anyone that particularly is struggling with headaches or tension or pain in head and neck area, toes will be the focus here. On the base of the big toe, this is where the neck is located. Across the diaphragm area, just above between the 2 toes, the ear is on the outer section of the toe and the eyes are on the inner section. One thing to consider as well, it is a reflection mirror on both sides, so all organs are connected to both sides, almost as the way the body is imaged as well. However, the only difference is that the gallbladder is on the right hand side of the foot and the spleen is on the left hand side of the foot. From here, the heart is located on the inner sections, the shoulders on the outer sections here where I'm showing you. Also again, working down the foot here, you've got your 3rd and 4th line, which is your upper and lower abdominal areas. And again, this is linked to the abdominal, colon and intestines. Down this line through here into the medial part of the foot, this is where the kidneys are. So working across and down. Again, there is a technique to use across and down from the intestines and colon, which I will go through in more detail when we start. And then the 5th section and the 5th line is the bottom part, where the pelvic area is, the bladder, where the sciatic nerves are located. And again, anyone suffering with sciatic pain, nerve pain, or back problems, this is a real good area to focus on and potentially repeat over a few more times. So again, depending on your client's preferences, these are the areas and points to focus on. The basic techniques that we will be using, one is called thumb walking. With thumb walking, it is important to make sure, as I'll demonstrate, when on a surface, you're going to bend into the thumb, compress, and then straighten, making sure to not flick through the thumb, as you want to keep that pressure on, and very slight movement, almost not moving at all. So it's compress, bend, straighten, compress, bend, straighten, and repeat that movement. Another technique that we will be using, which will be the front of the foot, on the dorsal section, is finger walking. Very similar process, same again, but this will just be using your index finger. It is optional to use 1 or 2 fingers. I prefer using 2, just adds that added pressure. And again, same movements of the bend and compress, straighten. Third technique to use as well is the slide and press. So again, through the thumb, we're sliding, keeping that compression, and then compressing and holding at the end in that located organ. There is some extra techniques as well, and some tips that I can give as we go along, and I'll talk you through those as we get started. So we're going to start through the 5 metatarsal areas down the foot section on the plantar. With this as well, you do not need any oil, which is really good. If your client does have dry feet, you may use 1 or 2 drops of oil at the most, just to allow a bit more movement. But as a whole, you do not need product for this treatment. So starting from the plantar section, I like to hold and cup on the back of the ankle just to support the foot with the client. And then we start from the base of the foot and work our way up to the toes. So from here, again, we compress and straighten, working his way up the foot. And again, I'm going slightly quicker just for video purposes, but you want to take this treatment really nice and slow, all the way to the base. And then moving on to the second line, bend and compress. All the way up the foot. And just checking in with your client to make sure that the pressure's okay. And again, at no point should the client feel pain. They should feel relaxing. And you're working your way up those 5 areas. And compress. And again, using the hand for support here. Again, making sure that there's no pressure on the base of the dorsal part of the foot, always putting that compression on the top. Once you've done those 5 sections in the metatarsal of the foot, you're then going to work across the 5 lines. So starting from the base of the foot, and again, optional to also then switch hands, keeping that connection with the ankle at the bottom of the foot to allow the client to feel supported. And again, if hands get tired, you can flick and change them between hands. Then working through the toes, same process, but you're bringing the elbow out. For this purpose, I'll just show for the video, but again, it's just the same movement of compression, release, compression, release. And again, I'll just show you on this foot just for video purposes. Compress, release, compress, release. So this is what this process should look like. Up the toes. Like say, base of foot is focusing on the neck, then working up through to the head. Same with the other toes, just making sure you keep that slight curve just so the toe isn't overextending when the pressure is applied. And working through the line 1 of the head and neck. And then I just like to add a compression through the ears on that toe where the 2 toes are based, and on the inner section of the eyes. And then before we begin onto the second line, which is the diaphragm line, slight curvature there where the metatarsals begin, I always just like to add a compression where the solar plexus is based in the central part of the foot. And again, just a nice compression in the central part. And release. Then working from the outer to the inner section, again, thumb walking, compress, release, but this time we're going across the foot rather than up the foot. Working away, slight curvature with the diaphragm, line. Then once we've worked across, we're then going to go to line 3 and 4, which is the upper and lower abdominal area. And again, working across through thumb walking. And then in the fourth line, where the lower abdominal is, where we want to focus on is where the intestines are located. Again, tip here is to go into a J-shaped position with this section of the foot. Again, working from the inner side, you're then going to compress across the intestine and then going down through to the colon, to the lower section. Again, you can also work onto the kidneys, which is the inner part of this foot located here in the curve. So again, with the kidneys, you're just going to compress and glide, working your way down to the inner foot, or option to start from the inner section and work your way out. Again, personal preference here. And again, if working to the top, you could link that back to the solar plexus. Once completed in the third and fourth line, you're then focusing on the fifth line, which is the pelvic area where the bladder is located, sciatic nerves. Again, if anyone is suffering with back pain, nerves, sciatic, this area is a really good place to focus on. And again, from here, you want to go across with the foot on the bottom section. It can be difficult to compress through the bottom, so I tend to use the fingers, and again, we're just doing a squeeze compression just so that area is not being forgotten. Once we've then worked across the lines and we've worked up the metatarsal areas, we're then going to work around the foot, so going down the vertebrae line and the vertebrae section here. So again, thumb walking the thumb down from the toes, not forgetting the edge of the foot here. And again, I'll just show you on this side for video purposes. Again, you're working your way down along the edge of the foot. Again, I like to add extra compression round the bottom. Then we're working across up the other side of the foot. Compress to the edge. Once we've then worked the 5 metatarsal areas across the 5 lines and worked his way around the foot, including the toes, I like to give an extra squeeze to the toes. And then we can now work on the front part of the foot. We will now work onto the plantar section of the foot, and from this section here, we're going to use finger walking. Again, similar process to thumb walking, but I like to use the 2 index fingers. And again, we're going to work between the metatarsals here, in between where the squidgy area is of each metatarsal. So again, we're going to start making sure that we're hooking at the back of the ankle from the top where the toes are located, and again, finger walking, we're just compressing straighten, compress, all the way up to the ankle, then across the second line, working between the metatarsals here. With the metatarsals, you have 5 located. With the tarsals, which is located in the bottom of the foot, the ankle, there is 7 in total, and there are 2 phalanges in the big toe and 3 phalanges in the other toe. So that's just something to consider when doing reflexology and to be mindful of. And then just working across that last line, all the way to the ankle. Once you've then done this area, again, you would do this much slower, but for video purposes, I'm just doing this slightly faster. And then again, continue to do the edges just for that added. And again, optional to use finger or thumb here. I like to use thumb just for added compression. And then same on the other side. And then once you've done here, optional to do the toes again if preferred, or again, I like to just give the foot an extra squeeze. And then I also like to work around the Achilles heel. So again, just giving some circular motion rolls around the back of the Achilles. And again, you may want to come back to a specific organ to compress. And then I like to just do a couple of rolls around the ankle. Again, no forced pressure here. This can feel relaxing for the client. And then to finish, I then just like to go up through the leg. So from this, from here, again, holding the back of the foot, drawing the hand up the leg, and then just sweeping down. And again, this is very much focusing on the tibia and fibular area, being the medial and lateral part. And again, this can just feel nice and relaxing, with slight compression on the draw up and down. And then again, I like to just add some squeezes. Another good technique you can do through squeezes is bringing the thumbs down, hands on the plantar section of the foot, and then again just squeezing out of the foot here, squeezing the toes at the end. With reflexology, predominantly it is a 30-minute treatment, 15 minutes each per foot. Sometimes that can be up to an hour, 30 minutes per foot, and it's really important to switch those hands for good technique. Another good tip to have as well is when you are using thumb and hands, always try and keep that thumb closer to the hand rather than overextending. This will put added pressure onto your hand that's unnecessary and cause a lot of pain and discomfort for yourself. So these are just things to bear in mind. So we have been through the 3 basic techniques of thumb walking, finger walking, and the slide and press. These are some added techniques that you can also use in reflexology, which is completely optional and again, personal preference to use. First one is the hook and back up. So from this process, what you're going to do is hook with the foot and hand, and then literally focus on a point of compression. From that compression, you're going to lean into the foot, but also draw the foot in closer. This just adds for deeper compression. A good area to do this on is also solar plexus. Again, I'll show you on this foot just for video purposes. So again, you're going to hold with the ankle still, hook with the hand, compressing the area in which you want to focus on, lean into that foot for added compression, draw that foot in. So again, should feel that slightly deeper pressure. And again, just checking in with your client during the treatment just to make sure that they feel okay. The other technique that we can also use is lung press. So through lung press, this is a good technique again for added compression. What you're going to do is the back of the hand, place this onto the plantar section of the foot. With the opposite hand, with the thumb, you're going to draw that into the central point of the hand and then bend and compress in. So it's again adding flexion to the foot, but also compressing with the hand, and release. And again, you can repeat this 2 or 3 times. Another good technique to use is dorsi and plantar flexion, and with this again through the foot here, it's going to be a focus on that flexion of the ankle joint. So this is really good movement here. What we want to use is the knuckle of the hand here, and then again securing the ankle with the other hand under the foot, and again we're just going to compress, working his way down the foot. Another section you can also use is supporting the hand with the foot, and again you can add forced movement here to really move the ankle as you are working down and up. And then final added technique you can also use is cross fiber. So again, you're going to bring those thumbs in, working across, using that friction up towards the foot. Again, some added good tips to also think about and consider is anyone that suffers with osteoarthritis or arthritis, just be mindful of the strength of compression that you use, particularly on the toes, as that can be a really sensitive area or sensitive part for the client. Always checking in with them during technique and process as well is really crucial to making sure that they are having that really relaxing experience. And then that is your completed reflexology. Thank you.